Hey, Molly, welcome to the show.
Hi, Brittany. Thanks so much for having me today.
It is a pleasure to have such a, prestigious, serious company like BD on the show. I love it. I love it. I love it. I love my founders. I love my startups, but it's always good to get some real foundational biotech companies on the show as well, right? Like with these long histories of doing the work. So excited to have you, excited to learn about BD's new innovations and strategies around women's health. So it's great to have you here. Let's kick off the interview with learning a little bit more about yourself. How did you get here? Where did you grow up? Did you go to college? Did you always want to be in this kind of field? But tell us about your journey.
Absolutely. Thanks again for having me today on the podcast. Really excited. So just to let you guys know, my name is Molly Broache. Right now, I'm serving as the Associate Director of Medical Affairs at BD Integrated Diagnostic Solutions. I started at BD in 2018 as a medical science liaison. I focus on our women's health portfolio. But prior to BD, I was really in the clinical space. So I have worked in the women's health field for 9 years. First, I was a registered nurse. I worked in labor and delivery. I worked in the women's OR. And then I continued my education and became a women's health nurse practitioner. So seeing sort of both obstetric and gynecological patients in a variety of settings. Women's health really is my passion, and I'm super excited to talk more about recent innovations in the women's health diagnostic space today.
So excited. Where are you based? Where are you calling me from today?
Awesome. So I am from Baltimore, Maryland. I was born here 30 some years ago. And I spent some time in Washington, D.C. and Arlington, Virginia and Philadelphia, but came back to Baltimore actually to work for BD, but it brought me back home, which is wonderful.
Cool. And what is BD? I was just at the gym telling my trainer, I'm interviewing BD today. And she's like, what's BD? And I said, as soon as you see the logo, you'll know who it is, because I actually similarly had that experience where I was like, BD, it must be short. And then I looked up the website and I was like, this is the BD, whoa, I don't know, maybe you're laughing. So maybe that's an experience you often have when people are like,
yeah.
And you're like, don't worry, you really know. So tell us,
right.
What is BD?
Yep. So we're definitely one of those companies that everyone knows by name, because pretty much everybody has touched a BD product at some time. So we're one of the largest global medical technology companies in the world. We have more than 70,000 employees around the world. I think a lot of times when we think of BD, we think of our specimen management business unit, essentially. So we have blood tubes, needles, urine cups. So I think if you've ever had to leave a urine specimen at your OBGYN or at the hospital, you likely used a BD cup. But what's really exciting about BD is, we have a women's health division too. And I think that's something that's becoming more important and more talked about within BD. And it was one of the reasons I was brought on to the company. It's just women's health and cancer is one of the many things we do. We have a microbiology division. We do a lot of COVID testing. We have the Veritor test. So within Integrated Diagnostic Solutions, we just have really a bunch of offerings across the spectrum.
Very cool. And do you know any history about BD, how old the company is?
Yeah, so we've been around for 125 years, so a very long time. And really the positive effect of BD's various innovations have touched probably billions of people worldwide every year. And we're really focused on both smart connected care and new care settings. So even since I've been here, which is 4 years at this point, there have been many new developments just in that short amount of time. We really responded to the COVID pandemic by coming up with new diagnostics sort of across our platforms. And I think we continue every day to be at the forefront of innovation, again, both in women's health and in all of our other divisions at BD.
Does BD stand for something?
Very good question. So BD is Becton, Dickinson and Company.
Oh, okay.
A little bit long and wordy to say, so most of us go by BD.
Yeah, they're I used to live in Texas, and the major grocery store is HEB, and HEB stands for Harry E. Butts. And so definitely much rather shop for my food at HEB than the Butts store. But
that's hilarious.
It's a very
Luckily not
great
that
family. Yeah, they're a great family in Texas. They do a lot of good. How old is the Women's Health Division at BD? Is it more of a newer initiative, or has it always kind of been there?
So really interesting question there. So the Women's Health Division is one of the relatively new sections of our integrated diagnostic solutions division at BD. The first women's health test that BD actually offered was on our BD Max system, and it's a Group B strep assay. So that's a really, really common test that's done for essentially all pregnant women at 35 to 37 weeks gestation. You get screened for this bacteria. It's a bacteria that a fair proportion of the female population harbors. It only really causes issues once your water has broken in labor and can pass on to the baby. And that test, I think at this point, that was acquired by BD about maybe 15 years ago or so. But since then, we have really expanded the women's health portfolio. So we have testing for sexually transmitted infections. We have a vaginal panel that's looking at the 3 most common causes of vaginitis. And really one of our most exciting tests and what's really sort of innovative at BD right now is our BD on Clarity HEV assay with extended genotyping. That test just got approval in 2018, and then we got approval for the extended genotypes in 2020. And that really is, I think at this point, the test that's really setting us apart in our industry and as a test for cervical cancer screening.
Yes, and I can't wait for us to get into that topic. We're definitely going to dive into that. I recently was meeting with someone who was questioning whether or not the large healthcare, and biotech companies are ready for women's health innovation. And I told them yes, because, startups, we've been seeing this huge growth in the last 5 years, particularly in the last 2. It's just been skyrocketing, right? Like it's just on wildfire. And I think that in a large pharma company or biotech, medical device company, the equivalent is the 15 to 20 years timeline, right? To get stuff done and move it. And so I said, yeah, I think that people are ready for it. They're ready to buy marketing research reports on it. They're ready to invest. They're ready to innovate in it. Do you think that's the case at BD, that y'all are doubling down, being like, this is absolutely something we need to prioritize?
Absolutely. I love that you mentioned that, because I really think that is exactly what BD is thinking too. And really, we have developed this whole innovative portfolio, again, within the last 15 to 20 years, along that same timeline, really focusing on these conditions that are affecting women and to an extent men. So, with the sexually transmitted infections test, for those, we are testing for both men and women. I think it's equally important to identify both to stop the spread of disease, essentially. But with the BD on Clarity HEV assay that has this extended genotyping, meaning we're giving really more information about what type of HEV a patient's testing positive for, we're really trying to take testing to this new level and really bringing in personalized medicine to the field of cervical cancer screening. I think personalized medicine is something we hear a lot about in other fields like genetic cancer screening, tests like that. But I think that care for cervical cancer screening deserves that same attention to detail and that same sort of individualized approach, and offering a test that has more information really allows you to do that.
BD is such a big company, 125 years old, much older than me, or anybody on this call right now or listening. But how does such a big company do innovations? What is your company's approach to innovation?
Excellent question again. I think we're really looking at what conditions impact people the most and really responding to that challenge. I mean, I think case in point, not women's health related, but the way we responded to the COVID pandemic with sort of rapid development of antigen testing, PCR testing. I think BD just is very good at sort of assessing the current climate and what conditions are most impacting our population and developing tests to respond to those conditions. And I think when we think about HPV testing, essentially, we all know that there are, more than 2 types of HPV that cause cervical precancer and cancer and need to be identified. Case in point, our HPV vaccine now tests, or it's called a non-valent HPV vaccine. So we are protecting against several high-risk HPV genotypes. And, within that innovation, if it's important enough to vaccinate against, really it's important enough to screen for as well. And I think that that thought process was used when developing this test.
Well, let's get into the cervical cancer thing, because as you mentioned, vaccines exist now, right? So is cervical cancer still an issue in the United States? Or, I mean, I'm thinking it is, considering you're screening for it. So kind of tell me about how significant is the impact of cervical cancer in the US? Is it still a problem?
Yeah, so sadly, cervical cancer is still an issue in the United States. So some recent American Cancer Society estimates state about 14,000 new cases of cervical cancer each year, and sadly, about 4,000 deaths. So this is not an issue that has gone away in this country, partially due to the fact that the HPV vaccines are still relatively new. So a lot of the women who are in the screening population right now, including, women, I would say around my age and older, were not able to get the HPV vaccine at the recommended age, which is around 11 or 12 years old. And unfortunately, the way that vaccines work, if you get it post-exposure, it's of limited benefit. It can, prevent against any additional HPV types that are protected that you might get in the future, but it's not going to take away a current infection. And we really know that screening for cervical cancer with an HPV test, and ideally a DNA-based HPV test, is the best way to screen for cervical cancer, because you really want to be screening for the virus that is causing the issues. So yeah, I mean, that it is still an issue, and there is a need for good diagnostics to be testing for this condition.
What percentage of cervical cancer cases is caused by HPV versus just spontaneous cancer? Does that spontaneous cancer ever even happen?
Really, really good question there. So HPV really causes virtually all cervical cancer cases, well over 90%, but there are some rare cases where HPV may not be the cause of cervical cancer, but essentially there's also a chance that maybe a cervical cancer was diagnosed and it was a false negative on an HPV test. Really, this virus has been pinpointed to be the cause of cervical cancer, which is why, I mean, it's pretty amazing the availability of the HPV vaccine as well, because when we think about it, this is really one of the only vaccines that's able to protect against cancer. I mean, how cool would it be? How cool would it be if we had that, for all other cancers, breast that cancer, kids at 11 to 12 could get that. Yeah. Yes, it's by having more people vaccinated, both boys and girls, with that HPV vaccine, we are hoping that, sometime, hopefully not in the too far future, we will see a decrease in cervical cancer cases and deaths. But screening guidelines have not changed for the vaccinated population. So even if you did receive, all of the recommended doses of the HPV vaccine, it is still recommended that you are screened according to societal guidelines for cervical cancer.
HPV is transmitted through sexual intercourse, right? Or is there other ways to transmit HPV?
Yeah, that is the primary way that it's transmitted. It's essentially skin to skin contact, though most likely with genital skin. But part of our issue is right now too, all the tests that are approved in the US, we only have indications for screening of the female population. Testing men at this point, or testing really specimens other than the cervix, are considered off-label. And I think that's something, and there are HPV associated cancers in other areas in the cervix, the throat, the rectum, various other organs can be affected by HPV infection and lead to cancers. I mean, I think there's been some sort of notable, cases of celebrities having HPV associated cancers like throat cancers and other cancers that are caused by HPV as well. So I think, when we think about future advancements, it would be nice to have tests that are able to screen both men and women for those other areas as well.
So we actually don't know the prevalence of HPV in the male population because the test we have for it is only in females. Do you have any hypothesis as to why we haven't made or figured out how to test males?
Oh, I know, it's the $1 million question. So I think part of the issue is, well, first of all, HPV is just overwhelmingly prevalent. One of my colleagues at BD sometimes calls it like the common cold of STDs. I think pretty much everybody who has been sexually active at one point probably has had some sort of HPV infection. Most likely it was a transient infection that cleared by the time you even got a test. And it's actually not recommended to screen very young women for cervical cancer by means of an HPV test at a very young age because of that, just because the body usually does take care of the virus and clears it in about 1 to 2 years. It's that issue with persistence. But going back to the question about males, there are nice clear-cut guidelines for what to do when a patient has abnormal cells on their pap smear or has an HPV positive test. However, with males, there's really no guidelines for what to do if they end up being positive. So there's just, I guess, sort of limited clinical utility. I know one of the things healthcare providers don't like is getting test results and then not knowing what to do with them. So I think at some point, if there was the development of guidelines that gave providers some indication of what to do with those results, there could be tests probably would be more commercialized and approved in the US.
It's just so crazy to think, and I'm someone, I got diagnosed with HPV. I was a freshman, I think, in college. And I remember getting the phone call and they were like, you have HPV. And my heart sank. I was like, oh my God, I haven't been safe. Like I made a mistake. And, I told my mom and she was like, what are you doing in college? And I was like, I don't know. And I look back at that and like, I really needed someone to be like, hey, like pretty much everyone's got a girl, like you're fine. Like, because I felt like, oh my God, I have to call past partners. Like I felt like it was so heavy. And now today I'm like, oh, I don't, it's like, yeah, it's like a common cold. Like most people have had exposure to it. So, but I do think it's very interesting that it's mostly females carrying the burden of knowledge of them having it or not, whereas they're like, we don't have it. And it's like, yes, you do. And you probably gave it to me. Like, but you don't know.
Absolutely. Exactly. Because there's no symptoms. And, I feel bad for you, Brittany, because I think, the only reason you even knew is because they did a test, potentially too early. I mean, right now, the recommendation is not to start cervical cancer screening until age 21. Mm-hmm. And some guideline bodies like the American Cancer Society actually recommend not starting until age 25, because again, the virus is just so common in those younger age groups and really will clear on its own. I think, the problem is exactly to your point, sort of worrying people too much, or potentially, over treatment of something that would just clear on its own if it was left alone. So I think I'm happy to see that guidelines have changed to really, reflect the fact that we want to be careful about screening younger women and what are the implications of that. Now, of course, there's always, terrible cases where somebody could have a persistent infection at a younger age and it is resulting in something, but the vast majority of women really are clearing those infections at a young age. And it's once you see those infections year after year and things not clearing, that there tends to be more worry and more need to know what genotype the patient's testing positive for and that type of information.
Well, obviously they've been screening for this for a while. I'm no longer a freshman in college, right? So these screens have been around.
Right.
Why did BD invest in creating an additional one? What's different about the new BD HPV assay?
Yeah, absolutely. So most HPV tests that are on the market right now have something called partial genotyping. So what they're reporting out is generally HPV 16 and 18, or HPV 16 and 18/45. And then they're grouping the other 11 or 12 genotypes into what we call a pool. Essentially what BD did is they are giving 9 different result reports with the BD on Clarity HPV assay. So we have 6 individual reports, including those 16 and 18, which again, traditionally have sort of been the 2 highest risk HPV genotypes, the ones that are most likely to result in cervical precancer and cancer. But again, we have 6 high-risk HPV genotypes reported individually, and then 3 in small groups of either 2 or 3 genotypes that are grouped according to risk. But essentially, one of the reasons we wanted to release this additional information is because currently those HPV genotypes that with other tests are included in this pooled result, they have very, very different risks for cervical precancer and cancer. So some of the high-risk genotypes in that group have a relatively low risk for cervical precancer and cancer and might end up being managed too aggressively, while other genotypes, and I really like to point out HPV 31. So HPV 31 really has a risk for cervical precancer and cancer that falls right under, or not right under, but under HPV 16, which is by far the highest risk for cervical precancer and cancer. And essentially, if that genotype is not individually identified, you're really managed according to a risk profile that doesn't quite fit you, because these other tests are grouping all these genotypes into one pool. So the hope is by providing this additional information about these genotypes, we can better manage patients, which would mean that women who test positive for HPV 31, just recognizing the risk that they are at that higher risk for cervical precancer and cancer.
So what I hear you saying is it's kind of like a test to figure out if you have COVID or just regular rhinovirus, just a regular cold, and the precautions that one might take for one versus the other, right?
Right. And, I think it clues the clinician into how do I manage this patient correctly? Because I think when you're grouping everything together, you're sort of averaging the risk of all of those genotypes. Mm-hmm. So that's fine if you're on the lower end, but if you're on the higher end of risk and are being told you have an average risk, you might be told to essentially come back and get retesting in a year, when actually a diagnostic procedure to actually see if you have disease would be the more recommended pathway. So I think just giving some of this additional information really should help clinicians accurately manage and diagnose patients.
Yeah. You're mentioning, how physicians manage the patients. What is a typical way to manage a patient at really low risk? And what's the management of a patient with really high risk HPV?
Wonderful question. Lots of sort of complicated terms in cervical cancer screening. And so, when we think of the traditional pap smear, pap test, and an HEV test, those are all essentially screening tests. So those usually don't definitively give a disease status. When there's abnormal findings on a pap or a HEV test, generally the next step that a doctor takes is something called a colposcopy, not a colonoscopy, but a colposcopy. I know sometimes when I was seeing patients, they would get confused by that as well too.
You would be like, what? What are you talking about? Whoa.
Right. And that's just a procedure. Essentially, it's set up very similar to the PAP. A speculum's inserted. An instrument called a colposcope is used. Essentially, we're taking a better look at the cervix to look for lesions that are often caused by HPV. And about 85% of the time, I would say a small biopsy is taken. And that biopsy is really what's going to tell you whether the woman is negative for disease or has cervical precancer, or, in some cases, unfortunately, cancer, but it's usually with colposcopy, it is a precancer that's identified. Mm-hmm. After that, if your colposcopy yields abnormal results, often doctors will do what's called a LEAP, or an excisional procedure, where a larger amount of tissue is removed. But that is only in cases where the results of the colposcopy sort of reach a certain threshold of abnormality that's warranted. So several steps along the way, but I think that sort of explains why it's important that you don't lead somebody down this pathway that doesn't need to be, but also you want to direct the people who do need it, because if you let somebody, or you give false reassurance that a patient can come back in like a year, I think oftentimes patients think, oh, they said I was fine, I'm not going to come back in a year, I'll wait like 5 years. And then, if that infection stays, that is when you do have a high risk for disease. So we might enter like a pandemic or something like that again, and then people can't go to the doctor. Yeah. So I think, you really, if something needs to be done, you want to identify these patients ASAP.
Yeah. One thing that FemTech Focus is really passionate about is accessibility and, making sure that everyone is getting healthcare, because obviously the root of our cause is that sex is a unfair variable in healthcare. Whether you're male or female, you get different healthcare, but we also look at race and, getting different healthcare. I believe there's certain races of women and females that have higher risks of developing cervical cancer. I also know that there's different HPV strains in different countries around the world that are included in the vaccine. So I don't know if this has anything to do with the BD assay, but does it have any potential benefits to women of different races or ethnicities in terms of like capturing a positive result?
Yeah, really, really good question there. I think the nice thing about identifying more genotypes is that, to your point, I think in certain populations, certain genotypes pose a higher risk than other ones. We are the first to have an FDA approved test with extended genotyping. So I think in the forthcoming years, when we start running this test in lots of different populations, we probably are going to see some interesting trends. I know, historically there has been some data, but now we will have more data using this FDA approved test. And, improving access to care, one thing that BD doesn't offer now, but I think on the forefront of everybody's mind is home collection and self-collection. Yes. We've seen that it was a success with COVID. People are able to collect their own samples. And I think in the future, when we think about innovation and reaching more populations, that is something that, I would love to see considered. And I think, something BD as well as other diagnostic manufacturers have on the forefront of our mind.
Especially for offer that women's health. Women, we are busy,
right?
We don't have time to go, and we will deprioritize our health time and time again for everything else and everyone else in the world. And so at-home test is absolutely a huge priority for FemTech innovators, because we know that, if women can buy it and do it at home, she'd much rather do that than get naked in a, little cotton robe and have things probed. If she could just swab it at home, she'd much rather do that.
Exactly.
And
it's not a subpar service to be offering, because again, as we know, HPV is causing virtually all cervical cancer cases. So, this is the right test to be doing to screen for cervical cancer. And, essentially how it would work is if you test positive for HPV, that is when you would present to your OBGYN to essentially have a traditional pap collected and get the cells and all of that. But you would also have the reassurance if you're negative, using a highly sensitive HPV test, that you might not need to be subjected to that procedure, which, to your point, everybody hates. Nobody looks forward to that visit every year.
Molly, this is
every few years.
Such a great interview. My last question about BD is, maybe some future directions, or is there other areas in women's health that BD is passionate about, currently working on or thinking about?
Absolutely. And I think we spoke about this a little bit, but I think, really this trend toward making diagnostics more accessible to everybody. I mean, it started, we have our COVID at home test with the BD Barreto system. So we've already put that into patients' hands. And I think self-collection for HPV is another thing that is a big focus, and something that we would like to work on as a company. Because again, I really do think that will expand access to care for so many people who, for a variety of reasons, whether it be transportation issues, not wanting to go see an OBGYN, just so many different reasons to offer HPV testing at home. I think we're also just sort of always looking for new and emerging infections that are affecting women. So when we look at our sexually transmitted infection portfolio, just looking for new organisms that could be causing disease. With our vaginitis assay, I think we recognize that the microbiome of females is something that's not just a static thing. So just really making sure that we stay up to date with what is going on in the women's health field. And I think BD does a good job of engaging clinicians and laboratorians and researchers to find out what is going on, so that we know how to best develop these tests in the future. I think I was really excited to work for BD as a former healthcare provider, because I think it's, important to get insights from people who are actually seeing patients and knowing, how patients want to be tested, what sample types are acceptable, things like that.
Yeah. Well, this has been such a great interview. I have two last questions for you that our listeners really love. The first one is, we have a lot of aspiring entrepreneurs that listen. So what is an area in women's health and wellness that you think still needs innovating?
Great question. I think one area that I feel like still needs innovation is care for the transgender population. A lot of the tests that are FDA cleared right now did not include that group in their clinical trials, and often tests have to be used off-label. So I think a lot of focus should be given in the future to making sure we are very inclusive with clinical trials, or do post-market studies of our tests to make sure that the tests that we offer are good for everybody. And I think also this sort of plays into the self-collection thing too, just offering acceptable testing to make people comfortable and make people want to get testing, and removing sort of any of the stigma of maybe having to go to a physician's office.
Yeah, totally. Well, we love that here. We are big believers in FemTech is for female women and girls. There's lots of people with vaginas out there that need testing, that may or may not want the world to know they have a vagina, right?
Exactly.
Or like however they identify. It's so interesting. We live in a world where genitals are so not allowed to be talked about, but then all of a sudden there's certain people we're like so curious, and it's just like, that's their own business. Let them do it at home. So totally appreciate that. And then the last question we have is, what do you think the FemTech industry as a whole needs the most right now in order to be successful?
I think really just putting women in the forefront of everything when developing these new technologies. So again, if a company is coming up with a new test and wants to know what the best sample types are, like go directly to the women who will be using the test and ask them, would you be willing to, collect a sample in this type? Is this device that we're using comfortable or causing you pain? Things like that. I think just making sure that things we offer to women are things that will be used. Because again, if we put technologies out there that are not acceptable, they won't be used and we will not be screening.
Yeah. I have so many stories in mind of FemTech startups started typically by men being like, women need these gloves so they can change their tampon without touching themselves. And it's like, women are like, no, we're cool. We are totally fine touching that. Like, why are you creating waste for the world?
Right.
Obviously never talked to a woman about this. So yeah, I am right there with you. Molly, this has been such a great interview. Thank you so much for your time today.
Yeah, thank you so much, Brittany.
Awesome. I just ended the audio. I'm going to save it real fast. So that was great.
Thank you.
Really good. PR ladies, were the questions good in terms of, I know I added some that weren't technically BD approved, but I thought they also kind of were in line.
I thought that was great. I think that your listeners are really going to enjoy it. I did.
Yeah. Good.
I absolutely did.
Awesome. Well, then, Molly, we ask you to do one more thing for us. We start every episode with the guest's voice introducing themselves. So you say, hi, I'm Molly Broache, the Associate Director of Medical Affairs at BD. So you do your name, your title, company, and then you say FemTech to me is, and you give some kind of definition of what FemTech is to you. Some people give like a literal definition. Some people give a definition that's like associated with the topic of the podcast. So like, FemTech to me is, further developing screening tests that are convenient and useful for all women or something like that. Do you have something in mind you'd like to say?
Yes, but I'm actually thinking I might change it a little bit just with your focusing on the actual
we got 15 minutes, so we got plenty of time.
Yeah.
Feel free to edit it if you want.
Thank you.
Yeah, of course. That's why I also like to do it at the end, because people actually realize like, oh, I actually want to foreshadow a little bit,
Yeah.
Oh, my little guy's stretching.
Oh. All right. I think I should be good.
Awesome. All right. So we'll just be quiet for a second, and then I'll just give you a little point and you can go for it. And just a reminder, it's, your name, your title, the company FemTech to me is, and then you give some kind of statement.
Great.
Whenever you're ready.
My name is Molly Broache, and I'm the Associate Director of Medical Affairs for the U.S. region at Becton Dickinson and Company, BD Integrated Diagnostic Solutions. FemTech to me is putting women's needs in the forefront when developing and implementing tests for conditions that disproportionately affect this population.
It's awesome. I would invite you to do it one more time, because I could hear at the end you questioned it. And I always just want to give my guests, like, I know what you are capable of. So just do it again and end it with confidence, because you totally got it.
Okay.
Yeah. Whenever you're ready.
My name is Molly Broache, and I'm the Associate Director of Medical Affairs for the U.S. region at BD Integrated Diagnostic Solutions. FemTech to me is putting women's needs in the forefront when developing and implementing tests for conditions that disproportionately affect this population.
Boom. That was this is what it means to me. Yes, no question about it. So perfect. All right. Well, you're all set to go. I think I told you all the date it's coming out and stuff in our email threads. I just don't want to misquote myself, but I think I already emailed that to your team. So does BD need to listen to this before airing it for edits?
I don't think so. There's nothing on here that was a gotcha. And we
Nope.
usually don't approve everything for earned anyway. Amelia, you okay with that?
Absolutely. Absolutely.
Okay. Cool. Yeah.
Mila says so. I'm like, I know BD. I just don't want to make anybody mad.
You won't
didn't
make
say
anyone
anything
mad.
to make
That
anyone
was
upset.
terrific, Molly and Brittany. Just a great conversation. So engaging.
Good. I'm glad. And it's little fun too, right? It's
Yeah.
not like your sterile, typical, purely healthcare, boring. You're like, did that lady just say she has HPV? Yeah, everyone does. Shut up. All right. Well, I think I have everything I need. So, and so let me just know if the PR team needs anything, but I think we're good to go. All righty.
Great. Thank you so
Cool.
much, Brittany. Really appreciate
Yeah.
it.
And Molly, I'd love to reach out to you. Would you mind giving me your email if that's
Yeah.
possible? Maybe just drop it in the chat.
I'll put it in the chat. Yeah.
Because I'd love to follow up with you with some of the resources that I have at FemTech Focus that may be of interest to BD as they expand their women's health goals. So
We love that. Yeah.
I'd like to just follow up with you with that stuff.
Yeah.
So. Cool.
We're always
All
looking
right.
to talk to people about it.
Awesome. Great.
Whoever will
Great.
listen.
Have a great day, everyone.
You too.
Bye.
All right. Thanks. Bye.